Meet Alex. She has bipolar disorder and has been doing well for years. With support and the right medication, her life has been steady. She recently found out she is pregnant. She has a few questions.
Will I get sick again? Is my medication safe for the baby? What changes should I look out for?
Her partner suggested she share these concerns with a doctor. Bipolar disorder is a common and treatable condition that causes extreme changes to mood and energy. It affects about 2 to 4 out of every 100 people at some point in their lives. Bipolar disorder can consist of highs, known as periods of mania, which can last days and include positive or irritable moods and little need for sleep. Hypomania is similar, but symptoms are less severe. Most people with bipolar disorder also have lows or depression, which can include sadness, guilt, exhaustion, and loss of interest. Sometimes manic and depressive symptoms overlap in what is called a mixed state. During pregnancy and the postpartum period, also known as the perinatal period, it is helpful to plan early and stay in touch with your healthcare provider. In pregnancy, changes in medication or stopping medication suddenly can increase the risk for relapse into depression, hypomania, or mania. The few days, weeks, and months postpartum seem to be a time of fairly high risk for relapse. Out of every 10 people with bipolar disorder, around 3 to 5 will relapse in postpartum. Usually, this means a relapse into depression. Rarely, relapsing symptoms can present as mania or a rare condition called postpartum psychosis. In postpartum psychosis, a person can appear very confused with mania or depressive symptoms and have thoughts or beliefs that do not align with reality. For more information on postpartum psychosis, watch the video on the CanMat website. However, not all emotional symptoms that happen in pregnancy or postpartum mean that a person is experiencing a relapse. Many people with or without bipolar disorder may experience mild changes in mood after delivery. These emotional shifts are often part of what is called the baby pinks, which can involve having increased energy and excitement, or baby blues, which can involve feeling emotional, overwhelmed, or irritable. The baby blues affect 8 out of 10 parents, and the baby pinks is also common in early postpartum period. They do not usually cause significant problems, unlike major mood disorders. If you have concerns about whether your symptoms are a sign of a mood disorder, talk to your doctor to monitor your symptoms and ensure you get the right care. But when changes in mood or energy last longer than a few days, get worse over time, or make it hard to care for yourself or your baby, it's time to check in with your healthcare provider, and in emergencies, call 911 or go to your closest emergency department. If there are thoughts or concerns about suicide, call or text 988 in Canada and the US. The good news is that effective treatments exist to treat active episodes of bipolar disorder and to prevent relapse during the perinatal period. People can stay well with a care plan that includes medication, support, and routine check-ins. Alex, for instance, works closely with her healthcare team to track her symptoms. You can too. By working with a healthcare professional and creating a personalized plan, you can maintain stability and have a healthy pregnancy. See the CanMat video on treatment and prevention and the Seeds of Hope guide for more details on the CanMat website. With the right care, you and your baby can thrive.